Hello, my name is Charles. I'm a fourth year medical student and I'm currently studying medicine at Newcastle University. So the first thing that I did, I applied to do medicine twice. The first time I didn't get in. First time when I applied to Southampton University, applied to Aberdeen University, Dundee University and Nottingham University. Those were my first four. And the place where I got an interview was at Southampton. The second time when I came around to apply, the places that I applied for were Newcastle University, Nottingham University, Leicester University and Southampton University. So when it came to choosing universities to apply for, my logic was based on applying to where my strengths were, and that is the reason why I chose those universities. First time I applied, my obstacle was to do with my GCSE in maths, which was a C, and most universities required a B, and this was quite a problem. I had A for A levels, but my GCSEs were the issue. What I did, I resorted to applying for the foundation programs for Southampton and Nottingham University, as they would lower the requirements that I would need, and then I applied for normal courses as for Aberdeen and Dundee. Southampton gave me an interview and they would have had a foundation year, and that's how I got around it. Second time round, my application process, I was now on the first year of pharmacy, a degree course, and I could not really apply for foundation programs. So once again, I went on Student Room and saw which universities my UK CAT score and my A levels was best suited for, and that's how I chose my universities to apply to. So it was really not really based, I guess, for those of you who would have better grades, would have good GCSEs, you can then apply based on location and teaching style, which is probably a better way of applying. But for me, that was not really an option at the time, and I was just looking to see where I could get in with the grades that I currently had. One of the main differences between my application and my peers is most of my friends went to medical school straight from college because they had their predicted grades sorted out, which you needed 3 A's or above. For me, my tutor wouldn't give me those grades, so my application process was different. I was forced to apply for a different program, which was pharmacy, so I didn't get to have the opportunity to apply for medical school. Another difference of mine was I took a gap year. There's one friend which I took a gap year with, he got in, but I didn't. And usually in your gap year, most people get their place, I didn't. So that was another difference. And the final difference is I got in while I was on another course. Usually they would not accept you onto a medical program if you have started another university course due to it shows a lack of commitment in terms of not finishing that course. They would expect you to finish that course and come into the graduate entry program. So those are the main differences on how my application personally differed from other people. So the first thing is I started off with bullet points, just listing work experiences that I had been through, how they applied to me, and then I linked them into experiences that needed to be a doctor. I also looked at my personal life because I'm a person who has loads of hobbies. So for example, I attended the gym regularly, I was into swimming, I also did music, so I also rap, I also record music for those that don't know. These were unique bits of me that I wanted to incorporate into there, especially when showing that you are a well-rounded person who's versatile, who's not just a bookworm. That's how I facilitated those things into my personal application, and also just taking different perspectives from how my work experience relates to a doctor, which was unique and not the same as everyone else. That's how I tailored my work experience. Another important part of where I tailored my work experience was also talking about how I'm from Zimbabwe and how the economical crisis there has affected people and how healthcare has affected people, and me seeing healthcare in that country and healthcare here instilled a passion for me, and also a personal story about growing up with someone who had a certain condition and how that affected me and pushed me to want to study medicine. So those are the ways how I personalize my personal statement. The way other students can write a good personal statement first and foremost is they need to purchase this book right up here. This is one of the books which is very useful in writing a personal statement, and it's always a good starting point. And also writing your personal statement, just remember your introduction. I cannot stress this enough. Don't use a generic introduction using words such as from a young age, all I've ever wanted to do, studying subjects A, B, C, D. If you've read that introduction over 5 times in example personal statements, it's probably been overused. And you can imagine these people read those things year in, year out, over and over again. and you're not doing yourself any favors or helping yourself by starting with a boring introduction. Other tips for an interesting introduction is you could also use quotes that is quite quirky, something related to medicine, or a personal story, and make sure you just link it back into why you want to study medicine and how that will make you a good doctor, or qualities that it instilled that you needed to learn. And also the other thing I would say is make sure you include personal hobbies and interests. These are areas that are neglected in some personal statements because people think that focusing on the academic side of things is the only thing that you need to do, and yes, that is the case, but universities are also looking for a well-rounded person who can also take part in clubs, who can also take part in societies, because university is not just medicine, it's more than that, and they're looking for people who are unique and individuals who have character as well as the brains or the attention span or the commitment or endurance to study medicine. Also, when you're talking about work experiences, remember not to list everything in big long lists. It's important for you to say a point, what you saw, what you learned from this point, skills that were on show, and how it links to the medical profession. So it's almost like a whole reflection on how this thing that you saw, so if you saw a doctor taking out a tooth, or you saw a doctor doing an operation, why was this important to you? What skills were on show? And then how it actually links to the medical profession. That's the sort of level of reflection they're looking for, as opposed to just big long lists of things you saw. So the positives about studying medicine is it's a degree which you'll be taught in very different methods. So there are clinical attachments where you go to hospital and you're learning from a hospital environment, very hands-on, very practical, with still some lectures on the side. Then there's the university side of things where you're coming to lectures and you're getting the university type experience. So that's the positive, you get to learn in very different mediums. You're having a lot invested in you. For you to become a doctor, you have a lot invested in you. Your tuition fee if you're a home student does not even cover how much they put into invest into you. And also, what's also good, you come out as a doctor, and somewhat, if you pass, you're definitely guaranteed a job somewhere in the country. I guess preference then depends on how well you do, but you are guaranteed a job at the end of the day, and it's a rewarding job. At the end of the day, you're seeing yourself make some difference in someone's life, even if it's not treating that disease purely to cure them. You're still treating and reducing their pain, and you know that is something that's always a positive to take away, because you're always making an active difference. The challenges, first and foremost, are when you have friends from different courses who don't have timetables which are as taxing, and you're finding yourself, you want to do what they do, you want to go out as much as they do, but you can't because your workload is different. That's one of the biggest challenges that I have found, and I've had to remind myself that I've got a workload I need to do and stay put and stay strong. The content you're studying is not difficult, it's just the quantity of content you have to study in a very short space of time. And you soon learn methods to do that, but it takes a while for you to adapt and to learn those methods and do that successfully, I would say. Other challenges I would say is it's also emotionally challenging, especially if you're dealing with patients who are unwell. You know, it takes a tax on your emotions as well, especially in my psychiatry rotation where I was dealing with patients who are depressed or who are low. You know, that emotional transfer is really there, and you know, we're only human. You can't help but feel what someone else is feeling and feel for them as well. So that's definitely one of the things which I'll say is challenging. And also it's quite ruthless in terms of the examination. I don't know, here at Newcastle, in terms of if you fail an exam in one of the clinical years, you cannot resit that exam, you have to resit the whole year. So that's probably one of the most challenging aspects. It's quite ruthless, quite stressful, high-paced environment. But once you get the hang of it and you're in your element and you find how to study and you have your own network, everything is so good. So first and foremost, becoming a doctor. Once you become a doctor, you have 3 avenues you can take. You can do medicine, which is working in a hospital, such as on the wards, looking after patients, so respiratory, cardiology, GI, neuro, those kinds of specialities. Second one, you can go into surgery and you can be a surgeon, so you can obviously, once again, cardio, respiratory, GI, all those kind of surgeons specializing in those areas. Or you can go into primary practice and be a GP as well, and also psychiatry, which is similar to primary practice, can be in hospital or in the community. So those are the main options if you want to become a doctor. If you don't want to practice clinically, you can also go into research, which is also an option, which is a different branch. If you're not interested in those two after you graduate, you have a degree on your hands which you can practically use however you want, as the skills you're taught are very transferable to other areas such as business, and you can also find yourself in finance as well if you're really interested in finance and you're not interested in doing medicine anymore. But I would shy away from using these as reasons to why you want to study medicine. Try to go and study medicine because you want to be a doctor, because it's a lot of time spent studying for you just to do it, to do other things. But if it turns out to be other things that you want to do at the end of the degree, options are there to do other things. So top tips I would give for people who want to study medicine. So first and foremost, especially at this time of year, you need to make sure you've sorted out your admission tests. Make sure you choose an admission test which covers all the schools that you want to do. My personal advice is choose one admission test that covers as much ground as possible. If you don't mind doing more than one, that's good for you. But personally, I would advise to choose one that covers as much ground as you can, so that you can focus your energy on that admission test and do really well. Second of all, make sure you look and apply to where your strengths are, as well as where you'd enjoy to study and where it's financially feasible to study, because universities in London can be very expensive, and applying to a school which assesses in a way which your application is not as strong, for example ones that focus on UK CAT, when your UK CAT score is average, that is not going to go well and you'll be rejected. So those are the things to consider. And also the most important aspect of an application is also your interview. Once you are successful and gotten an interview, you need to know what type of interview it is. Is it an MMI interview, multiple mini station interview, or is it a traditional interview which you'll be one-to-one, getting asked questions by either a panel or one-to-one? So this is one of the things that you need to really consider, and make sure you practice interviewing styles and interview stations. If it's an MMI, make sure you practice interview questions if it's a one-to-one traditional interview. For those that are a lot younger, that are still in secondary school or still in primary school and are thinking, they want to be a doctor, make sure you start thinking about these things, thinking about your work experience in the coming up years. Make sure you think about your GCSEs, because obviously they still have an effect on you, and make sure you're getting the right GCSEs that you need for you to study medicine. Make sure your maths and your English are on point. That's the sort of things you need to think about. And for those who are at college and starting college, make sure you think about work experience, and make sure you get your work experience patterned. You need to get your work experience done, and make sure you look at the schools that you potentially want to study at, and make sure you understand what kind of work experience requirements they're looking for. There's no point doing absolute bare minimum work experience and it not being what they're looking for, or doing way too much work experience and then you don't have time for the rest of the application. So make sure you balance, you get the correct amount that they're looking for. And just an extra bit I would like to add is, I feel like, make sure you believe in yourself. If you have a dream, you want to study medicine, it's not easy, it's tough. The application process is difficult, but don't give up. Just because you fell once or fell twice doesn't mean it's not going to happen for you. What you need to do is you need to look at every time you fail or something goes wrong, you need to reflect accurately and truthfully to yourself and look at the situation and say, okay, this hasn't gone well. What could I have done better for this situation to improve? For example, if you fail because university rejects you because of your UK CAT score is not high, make sure you look into ways how you can improve your UK CAT score, different ways of studying, different resources you can use. If it's due to your interview not being great, make sure you talk to people who got into medical school and what they did for their interview, how they prepared for it, and also search online on resources such as the Student Room where people talk about interviews. Utilize all those resources and don't give up. If you fail off your first application cycle, try again. Your chances of getting in are higher. And if you fail again on your second one, I would give it another shot.